The reality of the matter is that in many intensive care units throughout the United States, there are not any board-certified ICU doctors or intensivists in those ICUs, and so a lot of the care is being rendered by physicians who are either not trained or not qualified to deliver gold standard level of care.
There are some very important procedures which today, if you're having a surgical biopsy, say for breast cancer, the traditional methodology is you'd go in and have a biopsy, the material will be sent to the laboratory, and then eventually it gets sent to a pathologist, and the pathologist will read it, and then they'll diagnose the condition, and you'll get the result 5 to 10 days later. And of course, for the patient, that's a big worry.
If you think about it, as a patient, the worst thing that can happen is you're sick, you're not feeling well, and someone hands you a stack of papers and says, good luck, like find your next thing.
Two of the founders, including myself, had a family member go through a traumatic medical diagnosis. In my case, I lost my dad. Even though you have more than 500 million radiology scans done a year in the US, more than half of them tend to get read by a non-specialist. Now, most of the stuff is routine, it's not really a problem. But if you miss that one thing that's not quite there, or you stage a cancer wrong, for example, it has severe outcomes.
Sustainability is critical to hospitals. Hospitals generate about 10% of all the waste in the United States. It costs them between 50 to 60% of what their spend is. Starting January of 2026, they all have to report to the federal government what they're doing to reduce that greenhouse gas emission and carbon footprint.
Enhancing access to healthcare is a real barrier and problem in the industry today. We need to continue to strive as provider organizations to make it simple for doctors, nurses, pharmacists, and other caregivers to provide care and to spend the absolute most amount of time in direct patient-facing activities as possible.
Without technology, you can actually do a real-time assessment while the patient is actually on the table. That real-time assessment means the patient can go home knowing that there's no likelihood of a recall.
The biggest challenge that we're solving is providing access to care. It's a win-win situation because for patients, they get access to better care, and for hospitals, they also get to keep that patient in their community.
The thing that we focus on is how does the patient find and get access to care? We make the experience much better in that we make it easy to find and get on the schedule with the person that they need to see.
We see impacting patient lives very specifically. We're able to lower the cost of healthcare, which improves the profitability of the provider organization, but also allows the organization over time to be more and more competitive in an increasingly cost-conscious environment.
The primary challenge that we solve is access. By taking technology and allowing the expertise to come into one single place, we're actually fundamentally shifting how radiology is being delivered.
Cost reduction is a big issue for hospitals. The other is staffing. They have a hard time staffing at hospitals. So our company provides the drivers, the operators, the management. So it's an outsourcing for the hospital. The biggest thing we're doing though is we're giving a sustainable product, and that is huge.
We're impacting thousands of lives every day, truly, on a day-to-day basis. And that has been incredibly satisfying.